empowered nurses and other healthcare professionals. Welcome to COVID-19 Survival Guide for Nurses and Other Healthcare Professionals. I'm Lori Brown, nurse attorney and your host for today's session. And I'm so excited to bring to you Gabrielle Traub. Gabrielle is a homeopathic practitioner, and I'm going to let her share her story in terms of how she got interested in homeopathy, and then we'll talk a little bit about what it is. So welcome, Gabrielle.
Hi, thank you so much for having me on the show. I just wanted to share that I am so grateful to be here today. I feel like the nurses and the doctors and all the medical professionals are our heroes right now. They are our absolute heroes. And if there is anything we can do to help them, we want to help them and protect them and keep them safe and healthy.
I wish I could do a poll right now. I wonder how many of our listeners have heard of homeopathy. But you've got an interesting story about how you got interested. Would you like to share that?
Absolutely. So when my mom was pregnant with me, I think she actually, her son suddenly had an adverse reaction to a medication and he died. And it was very sudden. He was 2 years old. He was a healthy baby boy. He took a medication that was prescribed to him by his doctor, and he had an allergic reaction. And I feel like I was in utero with my mom. I was born a month later, and I feel like I went through every single one of those processes of grief with her. Just the shock, the horror, the panic, the fear. Like I was just flooded with adrenaline and emotion. And obviously I came into a world where they were just absolutely stunned. Their little baby boy just suddenly died, and that kind of thing doesn't happen. And then fast forward many years later, I have another brother, and he had the similar type of reaction. And we actually had paramedics come and resuscitate him in the home. And luckily he survived. He's healthy. He has a beautiful family today. But after that experience, my parents were so scared to give us any medications. And I know this is very rare. It's not common for people to have this kind of reaction. But they started turning to other sources, and they found homeopathy. And the reason why they loved homeopathy, because it is so incredibly safe. It's so incredibly gentle, and we were pretty much raised with homeopathy our whole lives, and that's how I happened to become a homeopath today. And that's something that a lot of parents come and see me for, especially with kids. They're looking for something safe and natural for their families.
Mm. Yeah, homeopathy's been around forever, or a very long time. So what is homeopathy?
So homeopathy is a science of medicine that comes from Germany. It's been around for 250 years, and it was developed by a doctor, Dr. Samuel Hahnemann. Now, Dr. Hahnemann actually was very disillusioned with medicine of the time. They were bloodletting, they were giving people high doses of mercury, and he was very disillusioned. He thought there has to be another way, and he started, he was very proficient in many different languages, brilliant man, and he was translating a medical journal where he actually found a treatment for malaria using quinine, which is derived from Peruvian bark. And it's so interesting because today, with the whole coronavirus, we're looking at hydrochloroquine as an option. And that actually was the first homeopathic remedy that was ever developed. And another thing very fitting for today, I'm sorry to diverge, is that this is actually World Homeopathy Awareness Week on April 10th to the 16th. And this is something that is celebrated around the world, and something that I actually founded many years ago. So Dr. Hahnemann found, he was translating some medical journals, and he noticed a paper where they were writing about the treatment for malaria using quinine. Now, he found this was so interesting because quinine actually causes malarial-like symptoms. The Peruvian bark, which is what they derived the quinine from, actually causes malarial-like symptoms. So he thought, how can a substance that actually causes these symptoms be curative for those very symptoms that it causes. And this was actually a concept that was developed by Hippocrates many, many years before, and that there are two forms of medicine. One is the law of similars, and one is the law of opposites. And in homeopathy, we use the law of similars, like cures like, where we actually give a substance in a very diluted doses, nanoparticles, where that substance in gross amounts can actually cause those very symptoms that you reacted to, that you're experiencing. So for example, a very basic description of this is if somebody has difficulty sleeping and they have insomnia, as if they've been drinking lots and lots of coffee. And coffee is a very specific substance. The caffeine in coffee is different to that of green tea or a stimulant in yerba mate. It's a very specific experience. So if somebody has that experience of coffee where they're wired and their mind is full of ideas and they may be exhausted, they just wide awake, we may consider using the homeopathic remedy Coffea cruda, which is derived from coffee in very, very small nanoparticles to be able to treat that imbalance.
Interesting. So are these, they're called homeopathic remedies, right?
Homeopathic medicines, correct.
Okay, and are they controlled by the FDA?
They are all FDA regulated. They have the same strict guidelines. I can't just go in my backyard and make a homeopathic remedy. They are all produced in FDA regulated facilities. They are extremely safe. And the problem, I love supplements and herbs, and I do recommend them from time to time, but they are not regulated, and you have to make sure you're getting a good quality, even though they are very valuable right now. We know the benefits of vitamin C and vitamin D and zinc, and we can talk about some nutraceuticals. There's so many wonderful ones out there, but it's important for people to realize that homeopathic remedies are highly controlled by the FDA.
And they don't have any side effects, right?
So they don't have any long-term side effects. What they can have, and it's important to differentiate, is they can have what we call an aggravation. So if somebody takes a homeopathic medicine for, and if it's too strong dosage, or if it's taken for too long, the body can get a temporary reaction of symptoms, which immediately goes away within a few days after discontinuing it. The same thing happens if you're taking something for too long and your body needs something else. It will let you know by creating symptoms, and then we just discontinue it, but nothing long-term or permanent. And we use these remedies for babies, for elderly. So if you take a homeopathic remedy and you have any undesirable symptoms, and they're usually very mild, just discontinue the remedy, and those symptoms will go away within a few days.
So interesting. And so what has the experience been of using homeopathy during an epidemic?
So, homeopathy has been around for a very, very long time. It was very, very much used during the Spanish flu epidemic, during the cholera epidemic. It's been around for 250 years. And there's some really interesting statistics that we have in how effective it is, especially where we don't have any other options available. And Dr. Andre Sain actually has written an excellent webinar. We can include the link below with all that data and all the resources and links. But the mortality rate, I can show you some examples, was pretty impressive. For example, if we're just treating pneumonia, when we're treating it conventionally, if somebody has pneumonia, if it's bacterial, then we can give them an antibiotic, and that's fine. But if it's viral, that is really difficult to treat with conventional medicine. Usually can have an up to 13% mortality. Whereas with homeopathy, we've been treating pneumonia for hundreds of years, and we have lots of remedies that we know can be very helpful in the management of symptoms if somebody has pneumonia. Obviously, the homeopathy is going to work better when you have early intervention and symptoms are milder, and that's why the goal with homeopathic treatment in the management of symptoms and during any epidemic is to try and treat it early so that it doesn't develop into something more serious where conventional treatment is necessary. We want to try and keep the hospitals and interventions available for the people who really, really need them. So anybody who has mild symptoms, that we can nip it in the bud and help manage those symptoms and make patients more comfortable. We know that taking things like ibuprofen may not be the best situation in this epidemic, for example. And so if we can manage fevers by using homeopathic remedies, we may be able to avoid complications and so forth. We know how important heat is for this virus. Our body needs to be able to produce heat to kill the virus. But obviously, we don't want fevers to go out of control with and cause complications. So the homeopathy is a really nice balance to help mitigate that. So for example, in the treatment of pneumonias, historically, we have a 0.4% mortality, which is incredibly low. In the cholera epidemic, Dr. Hahnemann himself treated over 183 patients, and none of them died. And we know how severe cholera was in those days, especially pre-antibiotic era where we didn't have a lot of options. We've been using homeopathy for so long. We have so much experience. We have so much data. And we know how to treat these things because we have all the textbooks and the information from our homeopaths before us.
So is this something that you can just go to the Whole Foods or the health food store and buy over the counter? Or should you go to a homeopathic practitioner to get recommendations? What's the best way if somebody?
We certainly, thank you for mentioning that. We certainly do not recommend people treat themselves. This can be a serious virus in some people. So we really recommend working with a homeopath who has experience. And I'm going to add in the link below some free and very, very low income options that we want everybody to have access to homeopathic treatment. Money to not be an option. So I'm going to give you lots of options for that. But at the same time, homeopathy has actually been incredibly popular right now. People are wanting to use it. So I think it's a good idea to stock these remedies in your home. And they are under $10 each. They are so affordable. Many of them can be purchased over the counter because the thing is, when you need them, you want to be able to get them and take them right away. You don't want to have to wait and order them. We're really recommending that people do not stockpile homeopathic remedies. We want there to be enough for everybody. And one, $8 bottle that you can buy at Sprouts, some of the remedies you can buy at, or at any health food store, is enough for a whole household. There are ways to extend the remedy's use. You do not need a lot of it, but it is really helpful to have these remedies in your home ready to go in the event that you need them.
That's so interesting. So what has your been experience with the COVID virus so far?
So I personally do not have a lot of experience. I have only treated a handful of cases. I'm in San Diego, where we waiting. I've been I'm in communication with homeopaths all around the world, in China, in Italy, in Iran, in the East Coast, who have been treating it. So we are collaborating. We are working together as a team. We're sharing data. We're sharing cases. We trying to work together on a global level to help each other, because I have maybe 3 patients so far that I've treated, and one of them was in LA, so only 2 patients in LA. We're waiting. I know it's coming, but we do have a lot of shared collaborative experience from all the other homeopaths that we're working together with, and we certainly have a lot of experience treating flus and pneumonias.
Okay, so just so our viewers know, I have treated my 3 children with homeopathy for something that wasn't, for their symptoms, it wasn't worth it to go to the doctor or anything, and I was really impressed. My son had constipation, and I gave him a remedy in 45 minutes, boom. And who knows if it would have happened anyways, I don't know, but it worked, and he felt a lot better. And then the other 2, they were getting a fever. They were starting to get flu-like symptoms, and I treated them. And again, I talked with somebody about what the proper remedies were to give them, and again, they within 24 hours they were better. So
I want to mention a few things. So I have a lot of patients who are doctors and nurses and in the front line of these situations, and just some of the experience they've shared with me. For example, one of my patients is a nurse, and she's experiencing a lot of trauma over not the virus, but the situation that this virus has created. For example, she had a child die and she was only allowed to allow one parent into the hospital because of the protocols, and every cell in her body wanted to let the dad in and she had to say no, and she was just heartbroken. So I want to mention that there are some amazing homeopathic remedies that can be helpful in treating compassion fatigue, for PTSD, for burnout, for exhaustion, for excessive worry and anxiety. I'd really like to be able to share some of those options as well. And maybe we can post some articles below. It's, you know, these homeopathic remedies are so specific and we need to find exactly the right one. So it's easier for me to maybe give you an article that has a little bit more detail to help people differentiate between different remedies.
yeah.
But there's a lot we can do to support your stress levels, your adrenals, um, because this is going to be a marathon, and we know how burnt out everybody is already. And you know, there are other things too. We know how important getting enough sleep and exercise and nutrition and stress reduction techniques are, and fresh air. But sometimes when you're a nurse and you're working the night shift and you're exhausted and you come home and you're eating late, and it's just hard to find the balance of having that healthy lifestyle, even though you know how important those things are.
Wow. Well, that's great. You can treat all those things too, because I think, you know, that's the whole reason why I'm doing this series, is to be proactive so people can, you know, take care of themselves now and hopefully prevent, you know, the burnout, the fatigue, the PTSD, and all those other things if you're proactive now.
Absolutely. And, you know, I used to work in an inpatient treatment center for one of the conditions we treated was PTSD, and just the amazing effects of homeopathy on those mental and emotional symptoms, just to give you support. It doesn't take it away, it just takes the edge off and
Mhm.
helps you to keep going. And that's really what we want to do.
Wow. So just know, the message for the viewers is that, you know, there are alternative things out there, not just traditional medicine. We don't have a cure for this yet. We don't even have very good symptom management for this, but there's a lot of alternatives available.
Right. I want to mention some specific remedies, and not for you to treat yourself, just to have these remedies at hand. So it gives you a little bit of an idea what kind of remedies that we have to treat this. The most talked about remedy, and it's important to realize that this virus is actually showing up a little bit differently in different parts of the world. We know that we have at least 5 strains and probably more, and there will be more to come. And because we haven't seen a huge amount of cases in San Diego yet, we don't know exactly how this virus will present, even though we do have what we call some unique features. Like, for example, we know that for about 2/3 of the patients who develop coronavirus, they have a loss of sense of smell and taste. Now, from a homeopathic remedy perspective, that's significant because that helps us to refine what homeopathic remedies are helpful to manage symptoms and influenza-like symptoms that also have a loss of smell and taste. So a couple of remedies that are really showing up is bryonia. And in the bryonia alba stage, the patient has a very, very dry cough. Everything feels very dry. Often that cough can be worse for movement. The patient feels very thirsty and wants to drink large quantities of water. They often have a headache associated with it, which is with also worse for movement. Now, gelsemium, however, another beautiful remedy made from the yellow jasmine, gelsemium sempervirens. This remedy is helpful when the patient is thirstless, and often they will be extremely exhausted and fatigued. They can barely lift their heads up. I mean, they just can barely keep their eyes open. They can even be trembling from fatigue. And for them, they are absolutely thirstless, and they often have chills that go up and down the spine. And what's interesting to note that bryonia seems to be the remedy that about 30% of patients so far are responding to. It's not perfect. It's not perfect. We haven't found the perfect one, but it's enough to help manage the symptoms in many, many of the cases that we're seeing. And but patients may need different remedies for different stages of the virus. We have 3 stages that we've defined, with different homeopathic remedies being helpful during different stages. Another remedy that's really helpful is called Eupatorium perfoliatum, and this is a great remedy for flu-like symptoms or viruses where you feel like your bones are broken. You know, when you have the flu and it's that incredible pain deep in the bones and even in the eye sockets, your bones almost feel like they've been beaten up or broken. Eupatorium can be really helpful for that. We have a wonderful remedy called Antimonium tartaricum, and don't try to remember all these names. I'll give you a list of these remedies below. Antimonium tartaricum can be really helpful when there's a lot of expectorant deep in the lungs, which is almost impossible to expel. So you can almost hear like a rattle, and in homeopathy we call that almost like the death rattle. So this is a very severe form of pneumonia where it's difficult to expectorate anything out, and the patient is weak and exhausted from trying to expectorate. If we can give this remedy earlier on, then it may reduce them needing ventilators. And we know that there's a shortage, and we want to try and keep, those for people who really need them. Aconitum napellus. Aconite is a very important remedy. It's made from the buttercup or the Ranunculaceae family. It's a beautiful flower, and this we actually use the root. This can actually be really helpful for fevers that come on suddenly and fast and needs to be used early on, especially if there's a incredible fear like they're gonna die. That just like really, it's a great remedy for fright or shock or and fevers that are high and that kind of come on very, very suddenly. And another important remedy, the last one I'm going to mention, is Arsenicum album. And this is a very, very helpful remedy for people who are very, very worried about contracting the illness. They are nervous, they anxious, they germaphobes. I mean, we need to be germaphobes. We're all germaphobes right now, constantly washing their hands. But for them, it's even more so. They tend to be chilly. They are thirsty for just little sips of cold water, and but they are chilly inside and very, very anxious and worried and restless. This is also helpful for those coronavirus patients who have associated diarrhea, and helpful for managing that diarrhea. So those are a nice synopsis of just some of the few homeopathic remedies that we have available. We also have a remedy called Oscillococcinum, and that's kind of a very generic remedy that we use for flu-like symptoms. And Oscillococcinum is helping to some extent in some cases to manage the symptoms. So that's another remedy that's kind of a generic flu-like remedy that's available over the counter.
Yeah. So I do want to point out, and I like you to reinforce, is that, each remedy is individualized. One size doesn't fit all. You can't just go to like when you have a cough, you go get Vicks cough syrup or Robitussin or whatever it is. It's not like that in homeopathy.
It has to be exactly right, specific for that, your symptoms in that moment of time. And also the remedies should not be combined with each other. If you go to your homeopath and you've been taking 10 remedies and you've been taking them all at the same time, it's going to be a mess, and it's going to be very difficult for your homeopath to figure out what you need next. It's best when we give one homeopathic remedy at a time. That's the cleanest, the clearest way of assessing the next steps to be able to help you manage your symptoms.
Yeah, because then you'll know if it's working.
Right.
Yeah.
And what we find with homeopathy is it helps to reduce some of the anxiety and stress and helps your body to heal, and it's just very, very gentle. A lot of times when people take a homeopathic remedy when they're sick, they just go straight to sleep, which is the best sign because we know you heal beautifully when you're sleeping, and you need the sleep, you need the rest. And we just want you guys to be as healthy and strong, and not just healthy physically, but mentally and emotionally. This is such an unusual time, so stressful. I know that you guys are nurses and doctors and you prepared, but I don't think anybody really prepared you for this experience. I mean,
Not at all.
it's just taken the morale is low. We want to protect you guys as much as we can. You're so special, every single one of you, and we want you to take care of yourselves.
Nurses are great in an emergency. We know exactly what to do. We go and we do what we need to do, but we've never been in a situation where it's prolonged like this, and so it's really important that you keep your strength up, your mental, emotional, physical, and whatever you need to do to take care of you.
Right. And the other thing is, you signed up for this, but for those of you who had families, you didn't sign your families up for this.
Yeah.
So a lot of nurses and doctors are feeling so torn between wanting to show up and do a good job and also wanting to protect their families, especially if they have more vulnerable people at home. It's such a difficult situation that you are in right now. I can't even imagine. And just giving yourself some extra support on any levels, using all the tools that you have in your toolbox to
Yeah.
keep yourselves healthy and strong.
And know that there's other options out there, not just traditional. And you've got nothing to lose but to try it. And look at the resources below, and hopefully you'll find them really helpful as well.
The other thing to bear in mind is that by taking some additional support, it's if you get the illness, we're hoping that some of these additional management methods will help reduce your severity of the illness, but at the same time conferring immunity. So then, you've got the virus, you're done with it, you can go on and help more people. And still, we don't know for a fact that it confers immunity, but it's looking pretty good that it will. And so we're not suggesting in any way that you don't take precautions. You should, because we know that that's so important. But if it can help your immunity and go on and become, not have an issue with this in the future, it'll be a good idea as well.
Yeah. So how can our viewers find you if they'd like to ask any more questions?
Yeah, so I think I'm going to give you my website, which is sandiegohomeopathy.com. I'm also going to give you a link to if you want to find a homeopath in your area. A great resource is the National Center for Homeopathy. They have a practitioner database. And then I'm going to give you some links to the Homeopathic Task Force. And then the LA School of Homeopathy, the Los Angeles School of Homeopathy is running a very, very low, like very reasonable donation-based low clinic option, a low income clinic option for anybody. And all you have to do is pick up the phone, call in, and you will have an experienced homeopath help you through this process. You have so much going on. You don't want to have to decide right now to learn about remedies or worry about remedies, just to get the support that you need. There's so many homeopaths right now showing up, offering free services. We have a homeopath in San Francisco that's offering free treatment to seniors. There's just so many beautiful options right now, and we want to make those available to you.
Wonderful. Well, thank you so much for your information. You're like a walking encyclopedia.
Thank you. Thank you. And thank you to Lori for creating this resource. This is so wonderful. I know how passionate you are and really wanting to help nurses and healthcare professionals and make a difference. And I appreciate that.
Thank you. And to all our listeners, we love you. We care about you. Whatever we can do to help support you, we're here for you. And we wish you the best. If you're enjoying this series, again, please share it, because other people, may have never heard of homeopathy and be like, wow, this might be something that can help. So please share it. They can sign up at empowerednurses.org/COVID. So thanks, everyone. Thanks, Gabrielle. I really appreciate your help. Thank you.
Thank you so much. Stay well. Bye-bye.
Bye, everyone.